Hi, I'm Danielle, doula and perinatal mentor in the Mid-Ohio Valley. I help a lot of women with breastfeeding through my monthly breastfeeding, birth, and parenting social in the Mid-Ohio Valley. And I get asked the question, or I hear conversations, probably more so than somebody actually asks me, of engorgement after breastfeeding is normal. That's not true. If you are engorged, something is happening that shouldn't be happening. And it's not really like you're doing anything wrong or anything like that. It's just that something is happening that could probably improve. Usually this is a latch where the baby's not latched on efficiently as they could be to efficiently drain the breast. Baby might be nursing for a really long time or on the breast for a really long time, but they're actually not swallowing milk very well. So a baby just latched on or a baby just on the breast doesn't necessarily mean a baby is swallowing. And if you're engorged, it actually makes it harder for the baby to nurse and latch on. And so your breast need to be quite soft in order for that to happen. So getting support very, very early on, immediately after birth, within those first few hours and the first few days before your milk comes in to help you understand what to look for and notice when your baby is latched on well and know that if there is pain, there's a problem. So things that could cause this issue of engorgement are baby just not nursing, limited nursing sessions, pacifier or other artificial nipple use, regulating the baby. So 5 minutes this side, 5 minutes this side, or 15 minutes and 15 minutes, and whatever type of scheduling that you might be doing that can cause it. And then very commonly is also a baby that needs osteopathic manipulation treatment or other types of body work and maybe a tongue or a lip tie release. So if you're questioning what's going on, if you're in pain, if you're just uncomfortable, or you just aren't really sure if what things are going well, it's really good to talk to a experienced breastfeeding counselor, or a mom that's very experienced with breastfeeding, or an IBCLC, as well as not just finding somebody with these titles, but go get a perspective from anyone and make sure that if it doesn't work out, you get another perspective, or you go back to that person and say, that didn't work. What am I doing wrong? Or how can I change this? How can I make it better? So you have all of these professionals, all these people with titles that are available to help you, or women that have breastfed before and they can tell you some things that they did. And really having multiple perspectives is really beneficial, as well as making sure that professionals are referring you out to somebody else when they think that you could use a fresh perspective. Sometimes it's just a matter of somebody else telling you the same thing or motivating you and making sure, like, if you get information from just one person, they might not be available all hours of the day. And while I answer phone calls and messages in the middle of the night, I can't do that for every single person out there that needs breastfeeding. So I also have to refer out. And if I think that a mom is just struggling a little bit more than someone else, then I will refer, maybe you should see an IBCLC. Maybe you should get another perspective and see how that makes you feel, because that extra word, even if it's the same information, can be what a mom needs to go, okay, this is like really the thing that I need to keep working on. Or, oh, another opinion telling me that maybe probably needs to have their tongue tie released. So we're no longer sitting in these groups of people every single day nursing our baby. So we create that for ourselves. So engorgement is not a normal part of breastfeeding, but it is a common part of breastfeeding. So get support if you're engorged so that you can prevent any complications, any low milk supply, or just discomfort and frustration between you and the baby.